Dr. Ken Landau, thanks for watching. Let's talk about the transmission of gonorrhea among men having sex with men. Traditionally, this has been thought to primarily involve the penile urethra. Transmission without urethral involvement has been considered uncommon. It doesn't go from throat to throat. It doesn't go from throat to anus. Except that's wrong. So what happens now, the newer thought, is that the primary mechanism of transmission of gonorrhea among men having sex with men is from tongue kissing, from oral anal sex, and from use of saliva as a lubricant for anal sex. Traditionally, it's always been thought that transmission of gonorrhea among men is from unprotected anal sex. And it was thought that a man who presented with either anal or oral gonorrhea, well, we would have the partner with urethral gonorrhea, urethral infection. But the new thought is that's not correct, that actually the gonorrhea travels from throat to throat and throat to other sites, even with the absence of urethral gonorrhea. Now, gonorrhea is becoming an increasing problem, especially in the gay and the bisexual community. Worldwide, there are going to be 100 million cases this year, and there seems to be a disproportionate targeting of men having sex with men. Part of the reason is we now have the pre-exposure prophylaxis. We have treatment as prevention. So men are having more sex with more partners because they're not afraid of AIDS. And unfortunately, gonorrhea is becoming increasingly resistant to our treatment. We're relying now on the last group of first-line antibiotics, the extended spectrum cephalosporins, drugs like ceftriaxone. Used to be we treat gonorrhea with one drug, now we treat it with two drugs. We combine it with azithromycin, but now we're seeing resistance to both of these particular antibiotics. The World Health Organization considers gonorrhea to be a global threat. Centers for Disease Control considers gonorrhea to be an urgent resistant threat. Now, the gonorrhea is caused by Neisseria gonorrhea. That's the name of the organism. Well, there are a lot of other Neisseria organisms that aren't gonorrhea. And when the Neisseria gonorrhea, the organism that causes gonorrhea, happens to be in the back of the throat and intermingles with other Neisseria, they can spread some of their genes, and that seems to be the cauldron for the resistance. Now, the current public health strategy is based on the premise that transmission of gonorrhea in men having sex with men is a result of condomless penile anal sex or oral penile sex. It's thought that the urethra, plays a central role in the story of transmission. But very soon after infection occurs, a man will develop pain and a man will develop discharge, and most men are going to seek care within a very short period of time. And when they get the treatment, then they're non-infectious. So it would appear that just temporarily, the urethra probably is not the major culprit, at least in men having sex with men. On the other hand, gonorrhea in the back of the throat, in the oropharynx, is extremely common. In one study, it was present in 8% of men having sex with men in a sexually transmitted health clinic. In Seattle, they did a study and they found the population attributable risk of developing urethral gonorrhea. Well, it was from the mouth in at least 30% of the cases. The idea about the transmission of gonorrhea perhaps being due to kissing is at least 40 years old. But it was very difficult to attribute the risk to any specific activity because so many activities took place at one time. And then we had Dr. Christopher Fairley and his associates at Monash University at the Melbourne Sexual Health Centre in Victoria, Australia. They came up with a new concept. And their concept is that among men having sex with men, transmission of gonorrhea mainly is through the mouth. It's through tongue kissing, and it's through transmission by the saliva to the partner's anus or to the partner's urethra during oral anal or oral penile sex. And according to them, the urethra is not, let's repeat that, the urethra is not a major source of onward transmission. And the investigators finally evaluated the sexual habits of men having sex with men, and they found that kissing without having sex was as frequent with partners as kissing and having sex was. Well, they did a study. They did a very interesting study, and they looked in the sexual health clinic, of couples who presented. And they tested the couples for gonorrhea. They evaluated the throat and the anus and the urethra. They evaluated it with the nucleic acid amplification test. That's the standard test we use for diagnosis nowadays. And if the test was positive, they cultured the different sites. And what they found was that in 60 couples, 120 men, at least one tested positive. The average age was about 30, ranged from about 25 to 35. And 85 of the men had gonorrhea. 63 of the men, it was in the throat. 48 of the men, it was in the anus. And 25 of the men, it was in the urethra. Now, among the men who had urethral gonorrhea, 90% had symptoms. And the duration of the symptoms was just 3 days, ranged from 1 to 4 days. So they sought care and sought care relatively early. Now, none of the men had a history of gonorrhea in the past 3 months, and they excluded other men who had the urethral gonorrhea, found that condom use was relatively uncommon, less than 10% of the time, and they evaluated very carefully the strain of gonorrhea in the couples, and they found they were exactly the same. They did what's known as whole genome sequencing, so they knew that one partner gave it to the other. Now, among the 25 men who had urethral gonorrhea, 3/4 of the partners had throat gonorrhea and 3/4 of the partners had anal gonorrhea. And if we exclude partners where either has urethral gonorrhea, find 48 couples where at least one of the individuals had throat gonorrhea, and in 1/4 of them both had throat gonorrhea. And then they found that among men who had anal gonorrhea, whose partners did not have urethral gonorrhea, half of the partners had throat gonorrhea. And then they found that in 33 couples with either partner who had anal gonorrhea, 15 couples, both of them had gonorrhea, so half of them. And they excluded couples where both of them had urethral gonorrhea. So in the absence of urethral gonorrhea, no urethral gonorrhea, when one partner has throat gonorrhea, 1/4 of the time the other partner has throat gonorrhea. And when one partner has anal gonorrhea, 1/3 of the time the partner has throat gonorrhea. And by chance alone, we would expect that when neither partner has urethral gonorrhea, only 3% of men would have anal gonorrhea and 6% of men would have throat gonorrhea in those circumstances. So the history is consistent with throat gonorrhea passing by infected saliva, playing a major role in the passage to the throat and to the anus and to the urethra. And indeed, when one individual has urethral gonorrhea, the partner has a very high rate of infection in the throat or the anus, but it's likely that the bacteria passed to the urethra from the throat or from the anus. There is direct transmission from the throat to the anus, but we can't determine for certain whether it can pass from the anus back to the throat. The risk for anal gonorrhea seems to be receptive oral anal sex or use of the partner's saliva as lubricant for penile anal sex. But insertive oral anal sex doesn't appear to be a risk factor for oral gonorrhea. Now, if one partner has anal gonorrhea, it greatly increases the chance of both partners having anal gonorrhea. And even when we exclude couples, when both of them have urethral gonorrhea, if we exclude the couples where either has a throat infection, we find that there's a dramatic fall in the concurrence of anal infection in both partners. And condoms don't address the role of throat gonorrhea. So you can still pass throat to throat or throat to anus. Gonorrhea transmission in men having sex with men, tongue kissing. And it's the passage in oral penile sex or oral anal sex, or the use of saliva as a lubricant. But now we have an interesting method perhaps of prevention, and it's with an antiseptic mouthwash. You have to gargle. You can't merely swish the mouthwash around in your mouth. You have to gargle. And you do it for about a minute. You can even use dilute mouthwash. You can dilute it up to 1 in 4. And if we look afterward, if we look about 5 minutes after you gargle, it appears that there's about a 50% reduction in the ability to culture gonorrhea. If men just use a saline mouthwash, the reduction's only about 16%. Now, it needs to reach the oropharynx, not just the pillars of the tonsils. So you have to gargle, not just swish it around. And I'm sure they're not very happy with the endorsement, but it was Listerine Cool Mint Total Care that was used. So oropharyngeal gonorrhea is mostly asymptomatic, and it's the asymptomatic infection that's a driver of gonorrhea in men having sex with men. Heterosexual relationships are different. That's because the cervix is infected and it's asymptomatic in a significant number of times. Well, what kind of activities are men having sex with men engaging in? 75% of the time it's going to be tongue kissing, about the same incidence of oral penile sex, about 65% mutual masturbation, 35% penile anal sex, 25% oral anal sex. That's opposed to heterosexual couples where it's principally penile vaginal sex. Well, the estimates from a Seattle clinic are urethral gonorrhea in men having sex with men occurs in about 5 individuals in every 100 patient years. On the other hand, pharyngeal gonorrhea occurs in about 25 individuals per every 100 patient years. And it's well recognized that Neisseria can be transmitted from the mouth. Everyone knows about meningitis, Neisseria meningitidis. That's an oral bacteria, and that passes. Well, we have a relatively short duration of time when oropharyngeal gonorrhea continues to grow. It tends to spontaneously resolve in less than 12 weeks. On the other hand, if a person develops anorectal gonorrhea, it's going to take about 12 months for that to resolve untreated. So it requires a relatively high change of partner, high frequency of sex in order to maintain the oropharyngeal gonorrhea. And that seems to be what's happening in the men having sex with men community. In the 3-month period, the investigators from Australia found that on average there were about 3 to 4 kissing-only partners and 4 to 5 kissing and sex partners. And 75% of oropharyngeal gonorrhea seems to be transmitted by kissing. And obviously, condoms aren't going to have anything to do with the decrease in the incidence of passage. First reports of transmission of oropharyngeal gonorrhea came from about 1967, 1970 from Copenhagen. Then we had reports throughout Europe. There was an interesting case where a man kept getting oral gonorrhea. He would only have oral genital sex with his wife. He didn't have genital sex. Kept having recurrent episodes. Finally, the wife was treated, stopped having infections. Well, most of the time, when a person is treated for gonorrhea, whether it happens to be urethral gonorrhea or anal gonorrhea, treatment's going to be successful. It's only going to be successful about 60% of the time in pharyngeal involvement. Now, most of the time, when there is oropharyngeal involvement, 80% of the time it's going to be asymptomatic, and only about 10 or 15% of the cases they're going to be a sore throat. But it's no different than any ordinary sore throat. No distinguishing features. Varying degrees of redness, maybe a little bit of enlargement of the tonsils, maybe a little bit of an exudate, but that's pretty much it. But we do know that even if all you have is oropharyngeal gonorrhea, that it can get into the bloodstream and disseminate. Can do that and then cause major kind of problems. So in July of 2019, Dr. Farley reiterated that tongue kissing seems to be a major mode of transmission of oral gonorrhea or anal gonorrhea or penile gonorrhea, and actually they found a relatively high load of gonorrhea in expectorated saliva. So there you have it. Word to the wise should be sufficient. If you're at risk, get checked. If you have multiple partners, really ought to get checked relatively frequently, at least every 3 to 6 months. The only way to prevent the epidemic, appropriate caution, screening, and judicious treatment. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified when we post new videos. Appreciate your interest. I'm Dr. Ken Landau.